Hello everyone, my name is Boris Karaman. Thank you for tuning in to my presentation today. During this meeting, I would like to talk about how nursing informatics fits into American Nurses Association ANA standards of practice and how it contributes to the improvement of the quality of plan, June et al. 2021. Our goal is to analyze directions of connection between the subject, such as nursing informatics, NI, and the ANA standards, as well as how such data might help in improving and progressing the results related to this subject. It has been noted that linking nursing informatics with ANA standards of practice can foster effective performance in healthcare institutions. This presentation will also shed light on how the field of nursing informatics is connected to the ANA standards, as well as the quality outcomes. Standards in nursing practice outlined by the ANA serve as critical guidelines that facilitate attainment of favorable results. Accurate, reliable, and credible data is considered as validated data, which is crucial in areas of practice in filling the identified gaps and thus improving the quality, Ambani et al. 2020. In general, the presented validated data contributes to the evaluation of critical areas of practice, thus helping the nurses to make better judgments and address the issues with appropriate evidence-based interventions. It remains critical for the purpose of preserving the credibility of nursing practice that one is capable of distinguishing between invalidated and validated data, since accessing accurate information on which to base logical clinical decisions is critical. Ambani et al. 2020. Of specific interest, professional ethics and the law are considerations that bear an improvement in their practice in order to enhance quality of patients and the nursing professions. DIKW stands for Data, Information, Knowledge, and Wisdom, and it is a theoretical model that helps illustrate the role and influence of nursing informatics on the provision of care. It focuses on the continuum of data wisdom and points to the contribution of nursing informatics for helping the nurses in building wisdom out of the existing data, information, and knowledge. The ANA Nursing Informatics. It is pivotal to note that in the scope and standards of practice, nursing informatics is recognized as key in building wisdom for all nurses, particularly in the decision-making process and in the nursing actions preposition from data, information, and knowledge. Along with the artificial intelligence, AI, and clinical decision support, CDS applications, nurses are able to gain wisdom from the knowledge that they assimilate and be able to perform judgments. Where AI works in conjunction with DIKW framework, as has been outlined above, it empowers nurses to harness AI-supported wisdom in order to effect identification of problems and solutions, as well as to administer accurate and timely care. The following selected theoretical frameworks and models indicate how theoreticians have operationalized the use of AI and the DIKW framework to enhance quality outcomes within the area of nursing informatics. Thus, the verdict is that the utilization of DIKW in nursing informatics illustrates its applicability to the nursing practice and its direct correlation with the ANA standards. Siman and Dowling 2020. The DIKW model is used to explain how data, information, knowledge, and wisdom are interrelated. Every bar which is constructed leads to the subsequent level, data, information, then knowledge, and lastly, the coveted wisdom. By understanding and elaborating this model, it is possible to use DIKW for pressure ulcer prevention and improve nursing activity. It remains consistent with the evidence that nurses can systematically and objectively collect essential data concerning important risk factors, care practices, and causal factors from documented notes or records, those creating clinical and nursing diagnosis, individualized patient care planning, intervention, and evaluation database. ANA compliant, this lens shaped the formation of client-centered care plans alongside the implementation of research and ongoing evaluation of outcomes for optimum client results. The confirmation of data reveals that breakdowns in pressure ulcer prevention can be uncovered, existing issues can be identified and addressed, and evidence-based policies and procedures can be adopted which reflect the current state of knowledge. These results in turn are beneficial for tailoring the quality of care and outcomes in reference to pressure ulcer prevention in patients. The public health regulatory agencies, including Centers for Medicare and Medicaid (CMS) and the Joint Commission, have significant leadership responsibilities in the prevention of pressure ulcer development. ANA states that these regulatory standards in nursing are well in line with the prevalence of quality results in healthcare. Therefore, by conforming to their proposed standards, nurses provide essential safety and competency in healthcare services which are approved by the regulatory bodies as well as the ANA and other stakeholders in the healthcare sector. Geffen et al. 2022. This is important because it ensures that regulatory standards are met to optimize consistency, individual responsibility, and the safety of people-dependent services. Pressure ulcer prevention example is one of the critical areas in achieving quality patient care outcomes, and validated data is imperative to fill the identified gaps and to compare healthcare providers' performance and outcomes to improve knowledge and enable evidence-based implementation of best practices to enhance patient outcomes and optimize the quality of care delivered. The principles of ethical practice are critical, particularly in relation to the care of pressure ulcers. Geffen et al. 2022. It is imperative that nurses adhere to specific professional ethical regulatory measures, including beneficence, non-maleficence, and respect for patient self-governance in order to meet patients' needs and improve health outcomes. Moreover, legal requirements, rules, or laws, like patient safety legislation or documentation statutes, present a framework according to which nurses perform their functions. All the same, there is a notable harmony between ethics and law, as both dictate the right bearing and the best decisions that the nurses ought to take in the discharge of their duties, more so with regard to safety of the patient and respect to their rights. Combined with an ethical perspective, legal regulations, and an evidence-based database, nurses improve and develop the quality of specific outcomes in pressure ulcer prevention. It is evident that data collection is effective in the prevention of pressure ulcers and the general quality of patient outcomes, June et al. 2021. Based on these strategies, healthcare providers can use the following techniques in order to utilize validated data effectively. Use of electronic health record tools, EHR, to capture data in an organized format for tracking. Another useful practice to employ is a data audit completed on a consistent basis that allows for detecting issues regarding the data quantity and quality. These are good points, as it is clear that using validated data to the potential for improvement in relation to pressure ulcer prevention can be pinpointed by healthcare personnel. Applying these principles enables the identification of cycles and tendencies related to offered practices so that key areas for intervention with evidence-based approaches can be defined. The ANA standards paired with validated data prove that the goal of prevention of the pressure ulcers formation is attainable, meaning that healthcare providers have the capability to analyze data for the areas of patient care improvement, promote healthcare, as well as enhance patient safety. Nursing informatics and the importance of compliance with the standards of the ANA determine a positive effect on quality nursing results in healthcare. Geffen et al. 2022. Nurses must focus on informatics tools and technologies to support different types of processes and manage data efficiently to make better decisions and, consequently, to increase quality indicators. For example, informatics-supported interventions by considering the needs of stakeholders have achieved the earlier mentioned goals of decreasing pressure ulcer rates without compromising patient safety while embracing best practice preventative protocols and post-operative continuous monitoring technologies. Further, patient harm reduction is attributed to the informatics utility that leads to early detection of risks and supports the coordination of care, communication among the members, and compliance with standards. Another best practice found relevant, according to the literature review, is the need to ensure that the positive effects of nursing informatics on quality outcomes are promoted to stakeholders. The promotion can be reached by delivering data and statistics, including comparative results, before and after analysis, and cost-benefit analysis, which would demonstrate the practical benefits of informatics-driven projects. The information regarding pressure ulcer prevention depends on the correct answers to data validation questions. When the data is validated, the healthcare workers get to understand issues that might be missing or would want to be changed in the existing systems or decision models. By making use of validated data collection and analysis, it is easier to identify discrepancies or variations with regard to specific pressure ulcer preventative interventions. This enables identification of whether patient, caregivers, and other staff are compliant with pressure ulcer prevention practices and guidelines. This is why, by using validated data, it is possible to assess the quality of the delivered care and recognize factors that can produce changes with an objective to enhance the match with standards promoted by the ANA. Nursing informatics is pivotal with regard to the practice of nursing as a way to adapt nursing activities to the ANA standards and contribute to the effective accomplishment of positive qualitative results in healthcare facilities. To a certain extent, using informatics tools and technologies, the nurses can form the theoretical frameworks for the informatics applications to support the systematic and evidence-based structures of the practice to revolve around the patients. Also, while validated data are critical for mapping gaps and niches for the precise application of intercessions and progressing to excellent result, formal guidelines are crucial for embracing expectations and defending patient protection. Voluntary standards are also support the concepts incorporated in beneficence, non-maleficence, and patient self-determination, which in turn advance the creation of optimum care. With the use of nursing informatics as well as employing theoretical frameworks and validated data that adheres to legal requirements and ethical principles, it is possible to better support the quality and safety of care that healthcare providers offer, ultimately improving overall outcomes to meet the standards that have been set by the American Nurses Association while benefiting the patient. I would like to thank you for your time and attention. Please let me know if you have any questions. I would gladly answer them. Thank you.